Hi, everyone, and welcome to the Freedom from Addiction segment here on the Neil Haley Show. And I'm excited to welcome the program Reverend Winn Henderson. Winn, how are you? I just tell you that we talked about before, our days are pretty interesting, and all we're hearing all the time is coronavirus. But I'm not tired of it. I listened to our president's press conferences. I watched the entire media circus and wonder when we're ever going to get out of the woods.
Yeah, that's a real question that nobody knows. But I understand that you're having some issues in Pennsylvania where you live.
Oh,
And,
very close, right in not just Allegheny County, but our our township. So yeah, and assisted living center had many cases. But again, I'm very concerned about stories of fudging the numbers. So that's where we have to really be diligent and understand, just because we're all going broke because of this crisis, please tell the truth at the end of the day of how many cases truly happen. Because if you're just looking for funding, that's terrible, because you're taking a lot of people that have helped the economy out of the workforce to get better, to get this virus out of our country.
right. Well, we're going to do an update on COVID today. And the first thing that I want to cover is what are the symptoms of COVID virus infection? The list of possible symptoms has grown to include shortness of breath, dry cough, fever, hyperventilation, abdominal pain, headache, runny nose, sore throat, weakness, fatigue, muscle aches and pains, nausea, stomach upset, vomiting, diarrhea, loss of smell and taste, and red eyes. Quite a number of symptoms, or you could have nothing.
Yeah.
But it seems that mild disease can really look like anything. The likelihood of having COVID-19 depends in part on if there is an outbreak in your community and if you've had exposure to someone who has had COVID-19. This biggest unknown, though, is whether there actually is a lot of COVID-19 in your community right now. Because we have such poor testing rates throughout the United States, we really just don't know where it is silently spreading until there is a surge of more moderate to severe cases.
Now, this is a very big concern to me, because from day one, we were looking at symptoms earlier when regarding the flu, right? We thought the symptoms based on our reports from China and all over the world, that people that had COVID-19 or people that had aches, body aches, shortness of breath, fever, but all these new symptoms that are coming up really concern me, because I've had these symptoms, but yet if I would go and ask for a test, let's just say that I had red eyes and a sore throat for 1 or 2 days and never exhibited any more symptoms, and this is a question I'm asking you, I'm not going to be able to get a test. So I could be passing it on to many people.
Well, the idea of ramping up to get enough tests that everybody can be tested if they want to is really crucial to what happens in this pandemic.
It seems like it. So looking at all these things, what are the symptoms? Which you talked about that in coronavirus infection. So let's talk about mild symptoms.
So what do you do if you have mild symptoms, right?
Right, exactly, yes.
Well, practically speaking, if you feel unwell, you should isolate yourself. This means staying at home, staying away from family members, at least 6 feet away, in a separate room, and use a separate bathroom if at all possible. Don't share household items. Clean and disinfect surfaces, and monitoring your symptoms to make sure that you're getting better. You should check your temperature daily. Watch for worsening cough or shortness of breath. If your breathing worsens, call right away for medical attention. There are many cases where people are feeling okay and then suddenly worsen. And keep in mind that there are many other reasons for people to have respiratory symptoms besides COVID-19. Flu season is still going on, and allergy season is beginning in many places. Also, understand that as we still have a very limited capacity to test, it is very likely that you will not qualify for testing in your community for mild symptoms at this time. So again, if you start experiencing any symptoms, the best thing to do is isolate and watch. And if you live with someone who is sick, stay home and away from others for 14 days to make sure you don't develop symptoms during this time period as well.
Now, I know that you've been doing the research. What concerns me is the people, if we would have followed this advice that you brought up now through all the research 3 months ago, would we have as many cases right now?
I don't think so, but you don't have a lot of proof these days for anything. You just have people with opinions.
Right. Understand. Last thing, this is great information. The last thing I wanted to, because I do have questions, because you've been doing the research, you've been spending your time, as you said, caught up at home. What if you exhibit no symptoms at all? How many people, remember they bring up the word asymptomatic, and people get that confused. As a doctor, what does sometimes asymptomatic mean that you'll never ever have symptoms of the virus and could carry it?
No, it could come on later, but the trick to that is in testing. If we had enough tests, we could tell who was infected even though they were asymptomatic. And they're ramping up that, but how quickly they'll get to where they can test everybody, I don't know.
And the other point is, what if you have mild symptoms and that's it, and that was your virus, and you were carrying COVID-19, and you were like a ticking time bomb for somebody else?
Yeah, that's why it's good to socially isolate yourself, to maintain 6 feet between you and anybody else, and wear a mask and gloves.
And the problem is that we don't have enough masks for the environment if we're not cleaning them, and that could be another topic for another show. Like, these masks are very flimsy. These masks, we don't have the greatest masks. We don't have face shields. That's for the healthcare workers. We really have to go into a bubble till we find this out. Now, last question, because of you as a medical doctor, what are your thoughts about opening up the country very soon?
Here again, that depends on what the virus does and where it's at and how many people are infected. So I guess the decision makers will make that decision as time goes by. I can't make any determination now.
Okay, so best
Would,
place we can
would you
find
like
information.
to would you like to know um, when you would be out of the woods if you had mild symptoms?
Yes.
Well, in mild cases, it can take anywhere from 1 to 14 days to develop symptoms from COVID-19, occasionally even longer. But most people with mild disease develop symptoms around day 3 to 5 and start to show recovery in about a week. Some data suggest that people who go on to have more severe disease requiring hospitalization develop worsening symptoms after day 5 or over the course of the second week from day 7 through 10. There's also some data that people with fatigue, headache, abdominal pain, and shortness of breath seem to progress past mild disease, especially if their age is over 60 and if they have other health problems like heart, lung, kidney disease, cancer, and depressed immune system. But remember, anyone can get severely ill from COVID-19. We are seeing people in their 20s, 30s, and 40s without any medical problems get so sick that they need a breathing tube and a respirator.
Oh gosh.
Another finding that suggests that you may have more severe disease if you are having a breathing rate that goes over 24 breaths per minute. That's called hyperventilating. If you are breathing at less than 20 breaths per minute, it seems to be more reassuring. So if you have any of these symptoms that we mentioned, watch yourself very closely and let your doctor or other medical professional know quickly if your condition worsens. And I've got some questions. Well, when can I stop isolating myself? So with people with mild symptoms, it's also not quite clear when you should stop safeguards and come out of isolation. The CDC recommends that you can stop home isolation if you haven't had a fever for at least 72 hours, and that's without fever-reducing medicines, or any other symptoms you have had improved, and at least 7 days have gone by since the start of your symptoms. At the end of the day, there is a lot we don't know about this virus. Until testing capability improves in the United States, many of us who experience mild symptoms may never know if our illness is COVID-19, the flu, or a cold. But the most important thing to do if you don't feel well is to listen to your body and rest. This is so important advice, but it could be a huge challenge in many homes, especially if you are the primary caretaker in your family. But this is what we should be doing anyway. When we aren't feeling well, our body is telling us to pause, rest, pay attention, and take time away from others. Now, this is not just important advice during the COVID-19 outbreak. It's good advice at any time.
All right. Well, a lot of great information. I have so many questions that could be follow-ups for another show later this week, especially regarding uh, specific symptoms like stomach ache or taste or all these different things. It's very scary, and it seems like there might be different forms of COVID-19 developing, kind of like the flu, which is very concerning. And that could be for another show, so we can jot down all these different things. But where's the best place we can find information on you and learn more about you? Where can we go?
Well, I have a podcast. It's the longest spiritually based, single hosted radio internet podcast in the country. I've been doing that for over 20 years now, and it's free. And I'll give you the address to go to get to it easy. That's www.freedomfromaddiction.libsyn, and you spell Libsyn, Libsyn.com.
Awesome. Great information. Appreciate you coming by. Go to RevWinn.HendersonMD.com. Also to pick up the free book that you're offering your fans and friends. And, it was a great conversation and great information. Hopefully, hearing this stuff, we can open up the country again, figure out the best methods. But doesn't look like it's going to be May 1st. We'll have to keep praying and hoping at one point we'll be back to normal again.
Well, Neil, my mission or purpose in life is to spread this message that there's a cure for all addictive behaviors. And this is a spiritual cure, and the treatment program is profiled in my book, Freedom from Addiction, #3. And that's available on Amazon or wherever books are sold. if you meet three simple criteria, everybody gets well. I have the resources that you told about earlier, and I also would like you to consider following me on Twitter. The account is at Hugo the Artist. And that was because when I started my Twitter account, I was putting up artistic kind of stuff. Now, every day you can get inspirational and educational tweets from not only myself, but important people that have already lived and died. So go over to at Hugo the Artist on Twitter and see what I've got for you.
All right. Well, thanks for the call slash video for people to check you out on YouTube or any of our syndication. And I appreciate you coming by.
Thank you, Neil.
All right. That was the Freedom from Addiction segment, everybody.